can do.
Seize control of the FDA!
There is nothing we can do. That's what I heard beginning in the early 1980s, when people in my life started to suddenly become sick with things that no one could explain.
We're at a time when there were not basically any effective treatments we now know.
The first report had just come out, and after seeing a patient, I saw a second patient, then another patient, and then there was an explosion.
Years and years ago, AIDS was something that it could not even be mentioned around anyone.
We decided that we could be the scientists. We decided that the doctors could be the scientists. We decided that we had a place at the table.
And certainly ACRIA grew out of that activist spirit of, let's not sit around and wait for the government to do this for us. Let's do it ourselves.
The research is what really is the most important of all, because as you see now, you see people that have AIDS that have been living for more than 20 years.
Well, no one thought people with AIDS would live to be 50. No one thought that there would be large numbers of heterosexual women with AIDS. Well, now there's a lot we can do, but now there's a whole new set of problems because the people that need the help are a whole different set of people.
In the last couple of years that I realized there's still something going on.
Who knows 10 years from now where we're going to be with this epidemic, but I have a feeling no matter where we are, ACRIA is going to be out in front, adjusting those needs.
As a board member of ACRIA, it's very important that we get involved, that you get involved, because this is a continuous fight. A lot of people are fighting every day for their lives, and it's fundamental. It's just an amazing organization, and the support that we give is invaluable.
I wanted to speak out today as a person with AIDS who is not dying.
I take hope when I see the children, the HIV-infected children of my patients going to college. I take hope when I see an HIV-infected woman give birth to an HIV-negative child, because it means that the virus has interfered with that one person's quality of life, but it hasn't stopped the continuity of birth and life and death and generation after generation. It's a problem to be overcome rather than something that will destroy us.
What we're trying to do at ACRIA is pay it forward. I came from the generation that saw the decimation of my community by AIDS, and the younger community hasn't seen that, and we're trying to simply tell them this is what happened and this is what we need to do.
It's still an epidemic and it's still incurable, and I think it's really important for young people to pay attention to that, because just because it's less obvious doesn't mean it's not there. And I think it's our duty as the next generation to be able to resolve and find a solution for AIDS.
The thing with ACRIA is that it's an organization that, as much as it's done, as much as it continues to do, we would really like you to put us out of business, because as much as things have improved, there's still so much work to be done. And one of the things, and when I was the president of the board, I always dreamed of the day that ACRIA wouldn't have to be a charity asking you for money anymore.
La industria de la moda ha participado mucho en la lucha contra el SIDA, y es una cosa muy buena porque la industria de la moda es muy visual y la gente le pone mucha atención porque la moda se ha convertido en algo muy importante. Les quiero dar las gracias a todos por estar aquí con nosotros esta noche, celebrando el gran trabajo que hace ACRIA por la lucha contra el SIDA. También le quiero dar las gracias a Vogue México y a Kelly Talamas por esta maravillosa noche en honor de ACRIA y la lucha contra el SIDA. Gracias.
Together, we can
Together.
end AIDS.
Together.
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 Together we can end AIDS.
ACRIA.
Together.
ACRIA.
Together.
ACRIA. Call it what you want.
Together,
Just join
we
us.
can end AIDS.
Join us.
We can end AIDS.
Join us.